70% of Americans say they want to die at home. And in reality, 70% of Americans die in hospitals and facilities. Hi, I'm Dr. Elizabeth Golding, Medical Director for the Palliative Medicine team at Cone Health, a member of Cone Health Medical Group. I would like to talk to you today about one of the most important conversations you can have with your loved ones, a conversation about end of life and advanced care planning. There's nothing more heartbreaking for me as a physician to sit down with a family who is in the midst of crisis. They have a loved one who may be nearing end of life, an unexpected heart attack, stroke, or other serious illness, and they have to make decisions about their loved one's care, and that loved one can't speak for themselves. By completing these documents, by having the conversation early, you're giving a gift to your family. You're giving them the gift of reassurance that they're acting in a way that you would want them to if your health should deteriorate. It may start at your first visit with your adult doctor. So you may begin by doing something called a living will or a healthcare power of attorney form. This form really is designed to protect you when you're young, should you have a horrible accident, should you have an unexpected serious terminal illness diagnosis, or should you get unexpectedly ill. It will guide your loved ones in making decisions that you would want. As you move forward through your life, there may be points where you need to think about revisiting your Advance Directive. And when I say an Advance Directive, I'm talking about the forms that support a conversation that you should have with your loved ones. A living will and a healthcare power of attorney are legal documents, and they do require signatures, witnesses, and a notary. As you move forward at certain points in your life, maybe even when you renew your driver's license, or as you age, perhaps if you have a hospitalization, or maybe even your job changes. Maybe you are involved in a high-risk job. Maybe you're in the military. Certain points in your life, you need to revisit your Advance Directives. One of the things that I always say, a good point to revisit your Advance Directives, is when you enroll in Medicare. And when you enroll in Medicare, you should make sure that you have your documents in place. And that should be a reminder to also have the conversation with your family. At the time of a new diagnosis of a serious illness, these things should require some preparation. One of the things we can talk about is how to start that conversation. The first part of that is thinking in your own mind and doing a little preparation before you talk to your loved ones. Thinking about what matters to you, and try to get a plan in place to talk about those things. It could be at certain points that you think are important. Maybe around the holidays when you have your family together. It may be just at the dinner table. Sometimes I'll say, think about somebody else you know who's been really sick. You can use that as a context for the conversation. If so-and-so isn't doing well, I would or would not want those kinds of things. You can also talk about it within the context of a newly diagnosed health problem. Sometimes family members will be taken back by the conversation. I remember talking to my 100-year-old grandmother who did not want to have that conversation. But it's really important that we talk about these things because we want to make sure we are doing the right thing for our loved ones. Not what we want, but what our loved ones want. That way, they won't have to live their life wondering, did I do the right thing for my mom? Did I do the right thing for my dad? Did I do the right thing for my wife or my husband? They will know, and they will have the confidence that the care that was provided to them at the end of life was the best that it could be. So advanced care planning is the way to ensure that that actually happens. Thank you for joining me. I hope this has been helpful for you and your family. Please don't wait for a crisis to occur. Start the conversation today about your wishes at end of life. For more information, go to conehealth.com/advanced directive. I'm Elizabeth Golding with the Palliative Medicine team at Cone Health.